Hi, Kaiser SDMC Group. My name is Sarah. Today I'm going to be talking assault, battery, and provision for in the Code of Ethics of Nurses. So to start off, assault is the threat um, or attempt on physical or bodily contact on a person without their consent. And then an example of this could be when a patient verbally um, threatens you to hit you, or maybe they even charge at you, but they don't actually touch you, but just a simple threat of that charge and that verbal threat is already assault. So the way that we nurses handle difficult situations like these could be using that therapeutic tone, having ourselves calm as well, so that we don't have an effect on that patient. And then again, also just knowing the safety steps, so like calling security, knowing that that is also in place to protect your safety, and also the patient's safety as well. And so for battery, on the other hand, it is intentional physical assault on a patient, on a person without their consent. So this can be from um, maybe doing a procedure on the patient without their consent, thinking that it's for their benefit, while in reality you aren't getting that consent for them. From like a nursing point of view, one of like the biggest things is say like a flu vaccine, a patient denies it. Maybe they just don't want to get a flu vaccine this season, and you accidentally, I mean, it's still going to be battery, but you give this person their IM, and now you've committed battery against this patient. So always knowing that you need the patient's consent before you do anything on them is super vital. And then just as like assault and battery, um, as stated in the Journal of Occupational Health, workplace violence has been increasing, especially towards the nurse, since they are that primary provider for the patient. So occupational therapists, respiratory therapists, physical therapists, they're not in that room with that patient. A lot of the time, they might be there a couple of times throughout the day, but because they aren't in there the whole time, then they are already placed at a higher risk. And so because of that, 17.2% of nurses who have been leaving their job, it's because of workplace violence. And then to end, Provision 4 in the Code of Ethics of Nurses talks about this nurses' autonomy, accountability, and responsibility towards the patient. And then, as stated in the article, Nursing Ethical Considerations by Lisa Haddad and Coben Giger, nursing decisions must be well thought, planned, and purposely implemented. So, through that, nurses should always take into account what this plan of care might be doing to the patient. Will it be doing them harm, benefit? And then just always advocating for this patient as well. And as my nursing perspective, I think it's important to know that workplace violence is increasing. So always having your safety and your patient's safety as well in your mind. And then with regards to the Provision 4, I think it's also important to note that we as nurses are responsible for our patients and should always be committed to their plan of care and their outcome. Thank you.